Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bon après-midi, tout le monde, et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Speaking on behalf of the province today, in the following order, are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Les porte-paroles aujourd'hui, dans l'ordre suivant, sont la médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Dr. Russell.
Bon après-midi à toutes et à tous. Good afternoon, everyone. J'ai encore une fois le triste devoir de vous annoncer que 2 autres personnes du Nouveau-Brunswick sont décédées des suites de la COVID-19. Je tiens à exprimer mes plus sincères condoléances à la famille des personnes décédées. Again, it is my duty to inform you that 2 more New Brunswickers have died due to COVID-19, and I want to extend my sincere condolences to the families of the deceased. Despite this sad news, we are seeing hopeful signs that the 4th wave of the COVID-19 pandemic is beginning to recede. The public health measures put in place earlier this month are working. Confirmed new cases of COVID-19 across New Brunswick are trending downward despite the increase in new cases today. Active cases are declining, and we are starting to see a reduction in serious illness, hospitalizations, and ICU admissions. You have all made this happen. Every New Brunswicker who has followed public health guidance and advice has had a part in our success to date. Je tiens à vous remercier sincèrement pour tout ce que vous avez fait et continuez de faire afin de ralentir la propagation de la COVID-19 dans la province. I thank you most sincerely for all that you have done and continue to do to slow the spread of the COVID-19 virus in our province. But still, I have concerns. Santé publique s'inquiète également beaucoup de l'augmentation du nombre de nouveaux cas dans la zone 2, particulièrement à Saint-Jean et dans les environs. Public health is very concerned about the rise in new cases in Zone 2, particularly in the St. John and surrounding area. So we're going to show a slide, and on this slide you will see that the black line shows the growth of cases in Zone 2, where the 7-day average of new cases has been steadily rising for the past week. This region now has the highest positivity rate in the province, with cases mostly concentrated in the City of St. John and Kennebecasis Valley communities. By working together, I am confident that we can bend the curve in Zone 2 as we have done elsewhere in the province. Premier Higgs will speak to our response to these developments shortly. But I want to assure you that your efforts are bearing fruit, and I ask that you remain patient and vigilant as we reduce the impact of the 4th wave. Aujourd'hui, Santé publique a confirmé 69 nouveaux cas de COVID-19 au Nouveau-Brunswick. Avec 51 rétablissements, le nombre de cas actifs dans la province s'élève aujourd'hui à 549. En date d'aujourd'hui, il y a 31 citoyens du Nouveau-Brunswick qui sont hospitalisés en raison de la COVID-19, dont 16 aux soins intensifs. Today, Public Health has confirmed 69 new cases of COVID-19 in New Brunswick. With 51 recoveries, the number of active cases in the province today stands at 549. Today, there are 31 New Brunswickers in hospital due to COVID-19, of whom 16 are under intensive care. The number of new cases has gone down by 50%, and the number of active cases has declined by nearly 1/3 since the circuit breakers were put into effect. And this is good news. However, our healthcare system remains under strain. And I just wanted to clarify to the public what this means, this strain to the healthcare system. So it does not mean that you're going to be denied access to acute care, but for the system to continue to provide acute care services, they've had to suspend elective surgeries and other services. One of the key measures in the circuit breaker areas is the reduction in close contacts. Remember, the COVID-19 virus doesn't move by itself. It needs people to carry it to new hosts. So when people stay in their one household bubble and avoid close contact with large groups of people, the spread of the virus is dramatically reduced. So I have another slide to speak to. And in this one, you can see the data that we've collected from our circuit breaker regions bears this out. So those tiny dots are really the hospitalizations trending, and you can see it's trending between the bottom curve and the second curve. And so that is a direct result. Those curves are really demonstrating what happens when the number of close contacts is reduced by a certain percentage. So the yellow line is a reduction of close contacts by 60%, and the gray line is a reduction of close contacts by 40%. And that trend shows a direct correlation with the impact on hospitalizations. So the blue dots, like I mentioned on the slide, are the actual hospitalizations that we've experienced, and the waves are part of that modeling. And so again, this is all based on what we know about people having reduced their number of close contacts. So that's really a great trend to see. The orange wave shows that if there was only a 20% reduction of contacts, again, so that's the third line. The gray line represents 40% reduction, and the yellow line 60% reduction. And the blue line demonstrates what would have happened if we had made no changes in our hospital, or rather in our close contacts, and what the hospitalizations for COVID-19 would have looked like. And literally, you can see they would have soared to over 100 cases, more than 3 times the current number. But with the circuit breaker measures, and the actions that the majority of New Brunswickers have taken to reduce their number of contacts, you can see that the contacts between individuals were reduced, and this has led to a corresponding decline in hospitalizations. So I think we can all be pleased that these measures are working, and again, I want to thank New Brunswickers who are, by and large, abiding by them. Bien que les mesures coupe-circuit se montrent efficaces, le plus important geste que peuvent poser tous les citoyens du Nouveau-Brunswick est de s'assurer qu'ils sont pleinement vaccinés contre le COVID-19. Vous pouvez contracter le virus même si vous êtes vacciné, et de plus en plus les gens pleinement vaccinés contractent le virus. La bonne nouvelle, cependant, c'est qu'une personne pleinement vaccinée qui contracte le virus est beaucoup moins à risque de devenir gravement malade et d'avoir besoin de soins intensifs. We have begun providing booster shots to priority groups, beginning with those who were vaccinated first and are most vulnerable to the impacts of the virus. We have provided additional protection to nursing home residents, the immune-compromised and healthcare and long-term care staff. Beginning the week of November 1st, people 65 and older and school personnel will be able to book an appointment to receive an mRNA COVID-19 booster dose if 6 months have passed since their second dose of a COVID-19 vaccine. Additionally, those who have received 1 or 2 doses of the AstraZeneca vaccine will be able to book an appointment to receive an mRNA COVID-19 booster if 28 days have passed since their second dose. We're also making plans for the immunization of children ages 5 to 11 when Health Canada approves a vaccine for this group. We will be ready to immunize the 54,000 children in this age group as soon as we have approval from the federal authorities so that our children can be effectively protected against the virus. In the months ahead, we will also provide booster shots to the general public based on the evidence of vaccine effectiveness. To date, we believe that most vaccinated New Brunswickers are still fully protected by the vaccine, as less than 6 months have passed since they were fully vaccinated. But public health is aware that boosters will eventually be required, and we will have a plan in place to make this happen. Now, for the children out there, this Sunday is Halloween, and I know that this is a very exciting time for children and their parents. And I do want to thank everyone, again, for following all the public health measures and advice thus far. And I do want people to be able to enjoy trick-or-treating, but please do it safely. Keep your contacts with others as small as possible, particularly in the circuit breaker zones, where you should go out only with your household bubble. I also suggest that people avoid being in close contact when handing out treats. We are still in the midst of a global pandemic, so we have to do things as we need to in order to keep ourselves and our families healthy and safe. We are getting positive results from the restrictions now in place. They are working because you are making them work. So please keep doing what you are doing by following public health advice, being kind to yourselves and to others, and keeping hope for the future. We will get through this. And we are getting through this. But again, we do need to keep working together. Thank you very much. Merci.
Bonjour, good afternoon. I was saddened once again to learn that we have lost 2 more people as a result of COVID-19. The last few weeks have been tough on our province as we have taken the steps necessary and the steps that were needed to reduce the spread of the Delta variant. C'est particulièrement vrai pour les personnes qui demeurent dans les régions où une majeure coupe-circuit est en place. Ces communautés ont été identifiées comme étant à plus haut risque. Et c'est pourquoi il était nécessaire d'adopter d'autres mesures pour assurer la sécurité des résidents. In some areas, those measures took effect on October 8th. Then they were extended on October 26th for another 7 days. The areas included much of the COVID of Zone 1, the Moncton region, the northern portion of Zone 3, the Fredericton region, and all of Zone 4, the Edmundston region. On October 22nd, the circuit breaker measures were also expanded to include all of Zone 5, the Campbellton region. The actions we have taken have had a positive impact. We went from over 1,000 active cases to 549 active cases today. We went from a high of 68 in hospital to 31 people in the hospital today. We also went from 31 people in ICU to 16 in ICU today. Of the 16 in ICU, 12 are unvaccinated. However, our hospitals are still under pressure, with 120 regional health authority staff absent due to COVID-related reasons. There are limitations to admitting patients in units designated as hot zones, such as surgical units at the Dr. Everett Chalmers Hospital here in Fredericton and the Edmundston Regional Hospital. As well, additional cases in shelters and long-term care facilities increases the risk of hospitalizations. As you may recall, we felt we could move away from emergency measures once we reached 10 or fewer people in hospital. We have not yet reached that point. Therefore, we have decided to extend the circuit breaker in all of these areas for at least another 7 days. As well, as Dr. Russell explained, the cases in these areas are part of a sustained trend, and currently Zone 2, the St. John region, has the highest positivity rate in the province. That is why the circuit breaker measures will be expanded to include areas of Zone 2. The areas impacted are New River Beach and LaPro to the west of the zone, north to the communities of Clarendon and Welsford, east to the community of Head of Millstream, and including all communities in St. John and Kings counties. The 14-day circuit breaker in Zone 2 will come into effect as of tomorrow at 6 p.m. The circuit breaker restrictions, limiting your contacts to single household, which includes individuals living together, caregivers for any member of the household, and any parent, child, sibling, grandparent, or grandchild living outside the household who requires support. Tout rassemblement à l'intérieur ou à l'extérieur est interdit. 47% of all exposures between October 12th and October 26th were related to household contacts of previous cases. That is nearly half of all exposures. Les déplacements à destination ou en provenance des régions où une majeure coûte-circuit est en place sont limités, à l'exception des personnes qui doivent se déplacer pour des raisons essentielles, comme le travail, les services de santé, la garde d'enfants, les services de garde d'enfants, ou l'éducation postsecondaire et l'exception des personnes qui vont à des événements où un cours de vaccination est requis. All schools will remain open unless advised otherwise by public health. Students in circuit breaker communities can participate in school sports and extracurricular activities following the health and safety school guidelines. Teams and extracurricular groups are permitted to travel within New Brunswick, including travel in and out of circuit breaker communities. All these activities continue to be subject to the guidance provided in the mandatory order. Spectators are permitted to attend school-related events, provided they follow masking, physical distancing, and any other operational requirements set out by schools or districts. All events will require the cooperation and support of families and community volunteers. Should not enough members of the community volunteer to help manage events, individual schools and school districts may choose not to allow spectators. Businesses, entertainment centers, and events may remain open and can continue to admit people who show proof of full vaccination and a government-issued ID. Children under 12, accompanied by a fully vaccinated adult, will also be admitted. Je remercie toutes les personnes qui continuent de respecter les mesures en place et qui prennent les mesures nécessaires pour se protéger et pour protéger leurs proches et leur communauté. What is being asked of you is necessary and is important if we want to keep New Brunswickers safe. We have done well getting control of this outbreak. Now is not the time to ease our efforts. We currently have 84.5% of our population fully vaccinated, and 92.4% have one dose of COVID-19 vaccine. I cannot stress enough that getting vaccinated, as well as following the measures in place where you are living, is crucial to your health and our success as a province. COVID is here to stay, and we must find ways to carry on our lives as normally as possible. And I believe we are doing that. Across our province, staff at long-term care facilities are taking COVID-19 seriously, and they have stepped up to get vaccinated and protect the people in their care. Of the 544 facilities in New Brunswick, 194 are 100% vaccinated, and more than half, 302 long-term care facilities, have a vaccination rate of 90% or above. Je remercie toutes les personnes qui fournissent leur part d'effort. Nous allons continuer à travailler avec le personnel des établissements de soins de longue durée pour atteindre un objectif de vaccination de 100%. Every parent wants their child to be safe and healthy and protected from unnecessary illness. That is why it is so important that when children bring rapid test kits home from school, that their parents ensure that the test is taken properly. This ensures the child who has COVID-19 gets proper care. Cela permet aussi de s'assurer que l'enfant n'expose pas les autres enfants et le personnel de l'école au virus. Nous voulons aussi prévenir que des enfants soient stigmatisés à l'école parce qu'ils doivent présenter leurs résultats négatifs chaque jour. As a result, we will be moving away from requiring close contacts of school cases to bring their negative POC tests to school every day. However, we will also need to have absolute confidence that the tests are being performed at home. To ensure this happens, the mandatory order will be updated to include a provision that makes it a finable offense to falsify or deliberately misrepresent the results of the POCT test. After 2 negative rapid test results, the child can return to school. If the results are positive, it is the parent's responsibility to ensure that the PCR test is booked immediately to confirm the results. The child must isolate until they receive a negative PCR test result. Today's news about the extended and expanded circuit breakers may feel like a setback, but in reality, it is a cautionary move to ensure that our case counts do not get away from us, that our hospitalizations continue to improve, that we continue to manage COVID within the system of our healthcare network that has done so well thus far and continues to do so. Nous réalisons des progrès et avec votre aide, nous allons continuer à progresser. Cette pandémie nous a appris qu'il y a des moments et nous devrons agir rapidement et d'autres moments. Et il est préférable d'adopter une approche plus prudente. I encourage everyone to remain patient, follow the measures in place, and remember that we must continue to work together to get through this challenging time. We can look around us and be so thankful for the position that we are in, but more importantly, the position that we're moving towards. We will be able to manage not only this outbreak, but future outbreaks. And we will do so by continuing to maintain the 90% plus vaccination levels and looking to reach those soon, and to continue to get third doses as required in order to maintain the health of our citizens, while at the same time reflecting that there's 10% roughly of our population that are refusing to get vaccinated. We must make up for that difference, and we must continue to be diligent. The fact that we have 92+% with a single dose gives me great confidence that we as a population will be able to maintain the required herd immunity, and we can continue to grow together. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre et Dr. Russell. Thank you, Premier and Dr. Russell. Nous allons maintenant procéder au période de questions avec les membres des médias. Vous avez le droit de poser votre question dans la langue officielle de votre choix. We'll now proceed to question period with members of the media. You have the right to pose your question in the official language of your choice. Each reporter will have one question. Chaque journaliste aura une question. We will begin with Travis Fortnum of Global TV.
Hey there, can you hear me?
Yes, thank you.
Perfect. Not sure who wants to address this. Obviously, there's been a lot of buzz in Zone 2 around a church leader who's, for lack of a better term, been shirking some of the COVID restrictions. I think that there's going to be a natural line drawn between rises in cases and now the introduced circuit breaker there and those events. Wondering how you would address that.
Hi, Travis. I'll start, and then if the Premier wants to add. I have been in touch with the regional staff in Zone 2 about many of the different situations that are happening concurrently. And my understanding is there has been an outreach with respect to communication and education and collaboration and engagement. So whatever happens moving forward, again, I've had some great conversations with staff in the region who have really done a great job. And I know other folks as well have been having those types of conversations. So at this point in time, again, we will move forward with the measures that we have and continue to encourage and engage and have those conversations.
Thank you. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, if an unvaccinated person recovers from COVID-19, how does their immunity compare to someone who's been fully vaccinated? And should a person who get vaccinated if they've just recently recovered from COVID? And sorry to make this long, but should our passports also, our vaccine passports also reflect recoveries from COVID-19?
Hi, Vicki. Thank you for that question. I have had people ask that question, and I had the information in my head, and it escapes me now in terms of how long you have to wait after you've recovered. There is a time frame, and I'll get that for you. I can't remember how many days it is, but you aren't really considered immune after you've had COVID. You do have to get vaccinated for many different reasons. Including the fact that you can get reinfected with COVID. There are different strains, and we have seen infections of COVID in people who have previously had COVID, et cetera. So at this point in time, that is our recommendation, but I will get back to you with the exact time frame after which somebody's recovered from COVID.
Thank you. Pascal Rochenog, Radio-Canada.
Bonjour, ma question est pour la médecin hygiéniste en chef. Dr Russell, je vais vous poser la même question que la semaine dernière. Qu'est-ce qui sont des éléments déclencheurs qui vont vous convaincre de lever des mesures coupe-circuit, entre autres dans le nord-ouest et le sud-est, en termes d'hospitalisation ou de nouveaux cas ou de cas actifs?
Alors, c'est vraiment prendre toutes les informations ensemble au niveau de la province et aussi au niveau de les zones, parce qu'on sait que le système de santé, on partage beaucoup entre Horizon et Vitalité à ce moment-ci. Alors, s'il y a des défis dans un des réseaux, il y a de la capacité dans l'autre, ils vont faire les échanges de patients comme si c'est nécessaire. Alors, s'il y a des éclosions dans plusieurs endroits en même temps, si on voit la transmission qui ralentisse pas, s'il y a des groupes qui sont vulnérables, etc. Alors, les déclencheurs comme tels, c'est vraiment de garder toutes les informations en même temps avant de vraiment être satisfait qu'on va continuer à diminuer les risques pour les taux d'hospitalisation, parce que c'est ça le mesure critique à ce moment-ci. C'est combien de personnes sont dans les hôpitaux, dans les soins intensifs. Et comme vous le savez, les deux réseaux c'était nécessaire dans tous les deux réseaux de changer le niveau de service qu'ils pouvaient offrir à les citoyens. Alors, vous savez que dans certaines situations, c'était nécessaire d'arrêter toutes les chirurgies, changer des services qui étaient offerts. Alors, quand la situation améliore dans le sens qu'on pourrait continuer, on pourrait recommencer à offrir des services qui étaient offerts avant ces éclosions, c'est ça, la trajectoire dans la bonne direction, la stabilité, les choses comme ça.
Merci beaucoup. Nathan DeLong, Miramichi Leader.
Good afternoon. My question is for Premier Higgs. Mr. Premier, I'm hearing a lot of questions and concerns in the Miramichi area about the looming provincial by-elections in the Miramichi Bay, Niguac, and Southwest Miramichi Bay to Vin ridings and when they might be called, along with concerns about a lack of representation in these ridings. Is there any more certainty, or has there been any more certainty since the last time we spoke about this on when you plan to set the dates for these by-elections? As I understand that the concerns about COVID may be playing a factor as well.
Well, certainly it is playing a factor, a crucial factor, and we need to, I guess, continue to ensure the area is represented. But I don't see making any decision on that probably before the new year, and it will be directly related to where our province is in dealing with this current fourth wave, and what it looks like going forward. So I'm unfortunately I can't offer any more certainty than the last time, but that it is dependent on where we are with COVID as part of the decision-making process.
Thank you. We're going to go to Adam Harris, please, of Brunswick News.
Thanks, Bruce. Question for the both of you, if you could. I just wanted an update on the Johnson & Johnson shots that New Brunswick has asked the federal government for. Have you received any? How many have you asked for? And how are you going to deploy them? Are they going to go to particular people, individuals in particular?
Yes, my understanding is we will be receiving about 500 doses, is my understanding at this point in time. And we are putting a plan together at this moment, and we can provide more details on that as we get them.
Thank you. We're going to go to Laura Brown with CTV.
Hi there. To either of you, my, I guess, observation, and others have been observing this as well, is that many of the cases over the last month have been under investigation, at least initially. There's not really a lot of follow-up after that. I'm wondering, how are contact tracers doing after the last month of influx of cases? And are more, have more been, figured out, contacted, and they're no longer under investigation?
Hi, Laura. So obviously, the higher the case count, the more difficult the contact tracing becomes. But the contact tracing is still occurring, and we've utilized many extra resources to make that happen. For those people who, some of those cases that were under investigation, they've now recovered. But there is, we do see community transmission in several areas around the province. So that is something that we're dealing with, and people have to be aware, again, by following all the public health measures that are in place, whether you're in a circuit breaker zone or not. It's really, really important, and getting your vaccine is really important.
Thank you. We're going to go to Bobby Jean McKinnon of CBC.
Yes, thank you. Dr. Russell, can you tell us more about the province's rollout plan for vaccines for children aged 5 to 10 once one becomes available, and how do you plan to address vaccine hesitancy among parents, please?
So we have received a really great presentation recently by our communications team, so that's very great news, and we've been in conversations with our partners at the national level in terms of what's going to happen federally with the availability of the vaccines, so when all of that is finalized, we actually have our plan in place to roll that out. We know that about 50% of parents are ready and waiting for that vaccine for their children at this time. For those people above and beyond those percentages, we do know that parents have a lot of questions that they need answered. So part of our plan is going to be making sure that we have a rollout that involves having factual information available to all parents, and a lot of that engagement will happen perhaps in local communities and areas with local representatives and local healthcare providers helping us amplify those messages at the local level. So we're looking forward to this rollout. There's a lot of thought that's been going into it, and so parents can look forward to that in the coming weeks.
Thank you, Ms. McKinnon. Simon Delatte, l'Acadie Nouvelle.
Je n'ai pas de questions aujourd'hui.
Merci, Simon. On va passer à Natalie Sturgeon. We'll go to Natalie Sturgeon with Global.
This question is for the Premier, a bit off topic, if you'll permit me, but in 2015, the Supreme Court of Canada said back-to-work legislation goes against the Constitution. It's a constitutional right to strike. In your decision, or in your pending decisions to do back-to-work legislation under the emergency order, did that factor in, and are you prepared potentially for any sort of suits that might follow if you have to force CUPE workers back to the job?
Well, certainly I'm hopeful that that won't be required, and we won't have a situation where we see a strike happening during a pandemic, and certainly during a time when there's an emergency order in place. Now, that would particularly apply to hospitals. The emergency order is put in place for the health and safety of New Brunswickers, but it could apply anywhere based on what the health risks were at the time. I don't take this lightly. I don't take the situation, that we're in emergency order and that I could use it. It's only if we are in a situation where the health of New Brunswickers are put at risk, and we find it necessary to put special measures in place in order to minimize that risk. And that has been something that has been applied all through COVID. So if I have to do it based on that, we would do it because of the rationale, that the same rationale that was used throughout the entire pandemic. It will be indeed for the health and safety of the province and the citizens.
Thank you, Premier. Thank you, Ms. Sturgeon. We're going to go to Erica Butler with CHMA. Erica? We'll move on to Miriam LaFontaine with CBC.
Hello. This is to Premier Higgs. I was wondering how many public sector employees are still not fully vaccinated and what the contingency plan is in place for them, especially considering the ones in the healthcare sector.
So currently, we're following the provincial average that it's in around 10% of public sector workers are not vaccinated at this time. That ranges through different parts of government, parts 1, 2, 3, and 4. It ranges from a vaccination level as high as 93% to some as low as, let's say, 89%. So roughly average, I say, of 10%. We are currently working through what that impact that has, and to your point, most notably on the health sector, should it be required to implement the rules that are put in place regarding mandatory vaccinations.
Thank you. Savannah Odd, Telegraph Journal.
Hi there, can you hear me?
A little louder, but yes.
Okay, my question is for the Premier. It's also a bit off topic. On the Official Language Commissioner's annual report yesterday, in the past 2 years, the Premier's office has seen 19 complaints against it, which is significantly more than the office has seen in any year, and it's more than the total between 2003 and 2018 against the office. So my question is, what do you think the barrier or barriers have been in the Premier's office to providing service in both official languages, and how will you address it?
So you're suggesting that we had 19 complaints in the most significant pandemic that we've ever experienced in the country and in the province, in the entire world for that matter, and that's I think we've done very well. I know that in relation to the polling that we did across the province, our communications was rated at 90+% in the height of the pandemic before the fourth wave. And it was certainly much to the credit of Dr. Russell and the team that we were working with to ensure that every communication we had was fully bilingual. And that's the advantage of being in a bilingual province, where we can utilize all the resources, including simultaneous translation, to get the message out across our entire province. We followed certainly the rules to recognize the importance of communicating in both official languages, and I feel that we certainly respected those rules throughout the entire pandemic, and we still do that.
Thank you, Premier. Mesdames et Messieurs, ladies and gentlemen, thank you very much. Merci beaucoup. Thank you to the members of the media and everyone for joining us. That concludes today's update. Merci aux membres de la média. Voilà la fin de notre mise à jour. Merci beaucoup. Merci beaucoup.